It is an invisible threat to firefighters across our country, more deadly than the fires they battle. Today, cancer is the leading cause of line of duty deaths in the fire service. Our Brooke Hash learned that nearly 75% of those honored at our fallen firefighter memorial last year died of occupational cancer. And this year, a local name will join that list.
I will say this was probably one of the hardest things I've ever had to do.
In a box marked confidential,
These are all like medical records.
close to 4,000 documents detailing Bruce DeArc's personal life and decades-long career with the Jeffersonville Fire Department.
I worked with Bruce when he first got hired.
Deputy Chief Jason Sharp knows how unpredictable the job is.
The runs you did one day will be nothing like the runs you do the next.
On the back of this structure.
Trained to face the fire and its immediate hazards, few are ever prepared for the job's long-term side effects.
I was one of those younger guys that thought that I'm invincible, nothing's ever going to happen to me.
I met Bruce back in 2018. He was 49, newly married, and chief deputy of the department when he went to the hospital for stomach pains.
The ER doctor, just based on the scan that he saw, said it's not good. It's stage 4 colon cancer.
It's the diagnosis he never saw coming.
I don't know if I could have done anything different to detect, what I had. I really, as I think back, there's nothing that really would have made me go sooner.
Bruce knew firefighters experienced higher rates of cancer, but options for testing were limited. And at the time, he was younger than the recommended age to get a colonoscopy.
I do plan on doing it soon.
Well, I mean, the issue is with your age, it's an insurance thing.
3 years later, that age requirement dropped from 50 to 45.
Firefighters here took that really hard, and they started paying attention to things after that diagnosis.
The department immediately added pre-cancer screenings to its annual physicals. It began enforcing new policies after each fire run, like decontaminating firefighters and their gear to reduce exposure to carcinogens, chemicals known to cause cancer.
You can have all the tools in your toolbox that you need, but it's up to the person to use those tools to protect yourself.
As Bruce would say, the black helmet is no longer a badge of honor. Clean your gear. Clean your gear. And that way you can go home to your family.
Over the last 2 decades, we've learned the fires battled today are not the same as they were 40 to 50 years ago.
And there was a transition that just seemed to happen, and nobody really kind of noticed it.
We went from fires that burn slower, produce a lot less smoke, a lot less toxins, to now where everything is pretty much a synthetic, producing lots of smoke. High amounts of carcinogens and toxins are being produced.
Up until last summer, the World Health Organization said cancer was a mere possibility in this profession. But in July, the job was reclassified as a carcinogen itself, on par with tobacco and benzene.
For male firefighters, we see a high rate of testicular cancer, almost 2 times the national average.
Right under that is mesothelioma, non-Hodgkin's lymphoma, brain, prostate, and colon cancer. The list goes on. And in women, the rates quadrupled for cervical cancer, almost tripled for cancers of the brain and thyroid, and breast cancer accounted for almost half of all female firefighter cases.
We live in a very toxic world right now. For firefighters, when you put a match to that, it's even more toxic.
One national cancer study found the firefighters have a 9% greater chance of being diagnosed and are 14% more likely to die from it than the rest of us. Last year, close to 75% of all the fallen firefighters added to the National Memorial died from occupational cancer. Each considered a line of duty death, though requirements are different for every state. Kentucky recognizes just 12 cancers for a line of duty death, while Indiana will recognize most, as long as you can pinpoint the cause. Impossible, right?
And it's not a single exposure that causes the cancer either, which is a big issue.
Hence that box of 4,000 documents.
They said it was the biggest submission that they've ever received.
Bruce's 4-year battle with colon cancer ended in February of last year.
This one was the hard one, really, the death certificate.
Stacks of evidence.
Letter written by the chief, supporting letters from our county health officer, different runs that he has made over the year, copies of different fires.
All pointing to the same cause for Bruce's cancer.
The suffering he went through was unimaginable, and with such an amazing attitude.
How the cancer affected his body was unlike anything I've ever seen in my entire life.
And even then, he was on a mission.
When it was just me and him in his hospital room one day, and he was like, "Please remember what this means. It's not just a me effort, it's a group effort.
Months later, Bruce's death would mark the first line-of-duty death for Jeffersonville Fire, a designation that opened people's eyes to the risks they face well after the blaze.
If he could just save one life, and that was, as a family, that was why it was so important to us as well. I know of people within this department in and of itself who have gone and got checked because of Bruce and have caught what could have been or what was early colorectal cancer.
And today, a game changer in the medical field, a blood test called multi-cancer early detection, or MCED.
And it allows us a way to look at up to 50 different cancers at one time in a patient's blood and find out if these patients, have cancer.
Scientists are already seeing remarkable results.
70% of the cancers that they have detected in some of the trials would not be detected any other way. Half of the cancers that were identified were stage 1 and 2, which is great because we're getting early detection.
The out-of-pocket cost is high for sure, about $1,000, but that's nothing compared to the price you'd pay for cancer caught in the later stages. Doctors are already prescribing it for high-risk patients.
You think about firefighters are the ones saving lives, and now we're having to talk about trying to save the firefighters' lives. And I think it's our time to start worrying about them, to making sure that they're healthy and they get to enjoy, the benefits that they've earned. So.
In Jeffersonville, Brooke Hash, WHAS 11, on your side.